For acute pancreatitis, we have a mnemonic, get smashed, to help us remember things. So most common, actually, we don't think about this as most common, but most common is gallstones for an etiology, then alcohol. Then you have others. Trauma, steroids, mumps, malignancy, autoimmune. This is IgG4, scorpion sting, hyperlipidemia, hypercalcemia, ERCP, which is a complication, an iatrogenic complication, and then certain drugs. So essentially for acute pancreatitis, we have premature activation of trypsin within the pancreas, which leads to autodigestion, activation of phospholipase A2, elastase, tissue gets destroyed, fat starts to necrose, you can have a vascular injury. This leads to local and systemic inflammation. Ultimately, if it continues to progress, it could lead to multi-organ failure. Um, Severe epigastric pain radiating to the back is going to be kind of your classic symptom. Worse with eating, better leaning forward. Low-grade fever and tachycardia. There can be some flank ecchymosis, which is due to a retroperitoneal hemorrhage. Colon sign, which is a periumbilical ecchymosis, and low serum calcium. Complications of acute pancreatitis, again, we're talking acute, could be pseudocyst or infective necrotizing pancreatitis or systemic. Pseudocyst is just a collection of secretions. This happens a couple weeks after acute pancreatitis, and there's pain and early satiety. Infected necrotizing pancreatitis, you'll see this kind of walled off necrosis that occurs after the pancreas has been infected and tissues have died. And then obviously systemic inflammation can lead to a whole host of conditions, multi-organ failure, disseminated intravascular coagulation, etc. Now, we can separate acute pancreatitis from chronic pancreatitis. The most common cause here is alcohol. And this is more of a constant dull epigastric pain that radiates to the back due to an exocrine insufficiency. So you can see steatorrhea, greasy floating stools, weight loss, and fat-soluble vitamin deficiencies. You could also see an endocrine insufficiency type 3C diabetes, which is pancreatogenic, um, and where you have like a loss of both insulin and glucagon secretion. And so this is more characteristic of our chronic pancreatitis presentation.